now going to show you the techniques the surgeons use to convince people to have a totally unnecessary nasal surgery. So if we look at the first one, they often claim that if you go there, the first thing they will have you to do is to have an X-ray performed. And when you get the result back from the X-ray, in many cases they would say to you that you have a deviated septum and that you need to perform surgery to have a better breathing. The problem is that they don't tell you that 70 to 80% of all people in the world have a more or less deviated septum. It's normal. And in most cases, if you are grown up with the deviation in the septum, it's not the reason for the nasal congestion, because the turbinates and the mucosa in the nose, it adopts its size and shape after how the nose is designed. So if we look on the left side here, for example, here's a person who have a completely straight septum. So you can see that the turbinates on each side here, the inferior turbinates, are pretty much the same size. You can see the black area here, it's where the air can pass. So you can see that there are air can pass in both nostrils here. Quite similar amount, I would say. If we go to the right side here, the middle image, we can see that this is the person who have a deviated septum. It's on the convex side here. You can see that the inferior turbinate has become smaller. And on the concave side, you can see that the turbinate has become bigger. And if we look at the black area, then the open area where the air can pass here, we have quite a lot in this nostril, and we have quite a lot in this nostril. So this person will get plenty of air. If you go to the other side here, here's a person that have a deviated septum to the other side, to the right side. So if we look on the convex side, it's a smaller turbinate again, and on the concave side is a bigger turbinate. And you can see the black part where the air can pass. It's quite similar to in both nostrils. So they don't tell you this. So it's a lie that most people, they don't need to have a septoplasty. There are other reasons for having nasal congestions, like inflammation, autoimmune conditions, allergies, food intolerances, histamine intolerance, mold, dry, dusty air, etc. So it's all about reducing the inflammation in the body. You shouldn't have a septoplasty performed, but they use this like an instrument to convince people to have surgery. Let's talk about lie number 2. If they can't find a deviated septum on you, they can anyway use another method to try to convince you to have a surgery to your turbinates. And it starts in the same way. They send you on an X-ray. If they can't find a deviated septum, they tell you that you have a hypertrophic or enlarged turbinate. But what they don't tell you is that turbinates are an organ that change in size from time to time. So it can grow, it can shrink, it can grow several times its original size. So you can't really do an X-ray taking a moment in time, a half a second, and tell if the nose is congested, if it has too little open volume or not, because you need to take several images to see how the nasal cycle reacts. And they know this, but they use this to convince you to have a surgery. So first they will show you an image saying, okay, we have found here, if you look on this image here now, we have found that your right turbinates is too large. You need to reduce that. That's the reason why you have nasal congestion. And if you look on it like a patient, if you don't know about the nasal cycle, it sounds reasonable. Sounds like, oh, okay, I understand that must be the reason for my nasal congestion, and then you sign up for the surgery. But if you look on another image here of the same person, if you look like this could be maybe an hour later or maybe 4 hours later. If you look now, can you clearly see here that the other turbinate is enlarged, and the turbinate that was too big the last time is now smaller. You have a extremely good airflow in that nostril. So yeah, this method is yeah, what to say, yeah, they used it to convince people, and they don't tell about how the nasal cycle works. In Sweden, and I think also in Europe, in many cases, there are healthcare system that is financed by the government. So the surgeon and the doctor should have a little bit less interest in making money from the patients, but it's not true in all the cases, because at least here in Sweden, it's common nowadays that surgeons start their own companies and sell their company's services to the hospital instead of being directly employed by the hospital. So if they have money interest in the surgery, of course they will be less likely to do a smaller surgery and to tell you the truth about the complications and the risks. In my case, for example, the surgeon who did my surgery, he has his own company named Arnbrandt and Rudbergs AB. So yeah, he probably had some interest in making money off my surgery.